The march on Saturday was a very striking demonstration of the power and solidarity of working-class people. 50,000 nurses, midwives, paramedics and their supporters in all sorts of different jobs and trade unions. A sea of INMO blue coming down O'Connell Street, coming on top of 3 days of very effective strike action. It no doubt struck fear into the heart of the government and brought them to the negotiating table over the weekend. And the proposals on pay, which the government had ruled out, quickly became possible. It's also the reason that fear of workers being organised in effective unions. It's the reason that the HSE, clearly under the instruction of the government, refuses to recognise the union of choice of over 500 paramedics, NASRA. There's a lesson there for all public sector workers and indeed all private sector workers. Getting organised and taking action can win concessions. It seems, however, that the government was not listening properly. What those striking, what those marching were demanding was pay parity and an end to the recruitment and retention crisis. And yet the government, it seems, is trying to get away with offering something seems significantly less than that. No wonder there is, significant discussion and disagreement from below with the government's offer at this stage. I'd say to Fianna Fáil, who, of course, we all know, gutted the health service, they say to us that it's not for the Dáil to tell nurses what to do. We agree. We agree. The Fianna Fáil's amendment precisely tells the nurses what to do, speaking about the Labour Court recommendation in glowing terms. But what it is for the Dáil to do is to say to the government what it should do. And that's what our motion does. Our motion finishes on the point of calling on the government to recognise NASRA and to pay in full the pay demands of the nurses. But I would also say this, that if the nurses and midwives reject the offer because it doesn't deliver the pay parity that they were fighting for, we will support them, the public will support them, and we'll be calling on other sections of the trade union movement to support them again, and that power will be seen once more and can extract more concessions. It's suggested that there's a problem with money in the health service. It's seen in the Labour Court recommendation where the nurses are meant to pay for their own small step at maximum 35 million, their own small step to pay parity through productivity. But there's plenty of money in the health service. It's in what is a health industry for profit. Denis O'Brien owns the Beacon Hospital. Their profits rose 27% to 8 million in 2017. Blackrock Clinic, part owned by Larry Goodman, its profits rose by 10% to more than 12 million in 2016. Pfizer Pharmaceuticals, a company with profits of over 12 billion globally in 2017, while they try to decimate the pension rights of their workers in Cork. Owned incidentally by Monsanto of Agent Orange infamy. It's a rogues gallery of those who profit from illness and from the privatisation of our health services. The problem is not that there aren't enough resources and money. The problem is how they're organised, increasingly on a for-profit and private basis. And the same is true right across society. There is plenty of money to pay the nurses. The question of who currently owns it and controls it and how that money is used. Look at the 270 million paid before Christmas to the junior Anglo bondholders. More than enough to pay the nurses' claim in full. Look at the 14.3 billion in the Apple tax account, which the government is spending money so that Apple can get it back. Look at the 29 billion held by the richest 3 people. The government's response to that would be to say, well, we have to make difficult choices. You cannot just choose to pay the nurses. But that precisely illustrates the madness of their policies and of their system from the point of view of the majority. We agree, choices need to be made. We disagree that these are difficult choices. They're easy choices. From the point of view of working class people and society as a whole, it is very easy to say we should pay nurses, not Anglo junior bondholders. That Pfizer shouldn't be able to cut workers' pensions while making super profits, and that private insurance companies shouldn't be able to profit off of the back of an underfunded health service. Making those easy choices means undertaking a difficult task, of transforming our society, of turning it on its head, of taking on the power of the major companies which profiteer from illness, which profiteer from underfunding of the health service and own the major sources of wealth, of saying that they should be in public ownership, of building a social society where they're used for the benefit of the majority. A crucial part of such a society where resources are used for the benefit of the majority is building a properly funded national health service where workers in it are respected in terms of union recognition, in terms of pay and in terms of conditions.